Ladies and gentlemen, thank you for standing by. Welcome to the Mastering Health and Sciences Recruiting Healthcare Virtual Roundtable. During the presentation, all participants will be in a listen-only mode. If you'd like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded Wednesday, July 17, 2013. I would now like to turn the conference over to Erin Jacobson. Please go ahead, ma'am.
Hello, and thank you all for joining today's webinar, Mastering Health and Sciences Recruiting, a Virtual Roundtable. As a reminder, this webinar is being recorded, and by the end of the day tomorrow, you will receive an email from us, which will include today's recording and information containing HRCI credits. This information will also be available at ere.net. Before we get to it, I would like to say a quick thank you to Jobvite for sponsoring today's roundtable. I would like to introduce Shannon from Jobvite, who would like to take a few minutes of your time before we start. Shannon is an account manager on the customer success team at Jobvite. Having grown her career in recruitment, Shannon has worked for employers such as Monster.com, Flextronics, and Silicon Valley Bank. She has a broad experience in HR and recruitment strategy roles and in launching HR systems, creating media strategies, and educating customers on best practices. Shannon, I'll go ahead and turn this over to you now.
Thank you, Erin. And hello, everyone. We're excited that each of you have joined us today for our roundtable discussion. Before we get started, many of you may not be familiar with Jobvite, so let me give you a brief overview. Jobvite is a recruiting automation platform. We only focus on recruiting. Jobvite provides tools and solutions for social, open web sourcing and search, talent pool management and collaboration, full social referral tracking, all the way through the hiring process. At Jobvite, we believe and provide the tools to make every employee part of the hiring and branding process. So let's go ahead and get started. First, I'd like to introduce you to all of our panelists today for our discussion. We have Irv Nahr. Irv is a highly experienced HR and recruiting professional with over 25 years of success in high tech, IT, nonprofit, and healthcare. He prides himself on building proactive recruitment teams based on a talent philosophy of hiring the best possible people rather than the best available people. In 2011, he joined West Penn Allegheny Health System as Vice President, Talent Acquisition, HR Operations, and HRIS. Teresa Toller. She is a talent acquisition leader with a passion for social media and mobile recruiting technologies. She's an experienced professional in all aspects of human resources. As Senior Director of Global Talent Acquisition for Onyx Pharmaceuticals, Teresa has proudly demonstrated achievements during periods of growth and new directions in the marketplace. And finally, we have Matthew Marconi. He is the Director of Recruitment for Greystone Healthcare Management and oversees the recruitment department and strategy for a 4,500 employee organization. Matthew also handles social media and website content, as well as developing employee engagement strategies. So let's get started today with our questions for our panelists. We'll have each of our panelists share their vision and strategy for recruiting at their company, including the structure of your recruiting teams. Irv, would you like to get us started?
Sure. At West Penn Allegheny Health System, we presently have a TA team of 8.5 recruiters, supported by 2 TA support reps and managed by a director. We support a 5-hospital system and a large dispersed physician organization, which comprised of a total of about 11,000 employees. Our vision for recruitment is really to be a strategic department within the health system while still meeting the tactical needs of the organization. And I believe strongly in creating an organization that's a corporate competitive advantage. I like to say that our recruiters have an opportunity that no one else in the health system has, and that's they get to build this health system one person at a time.
Thank you, Irv. Teresa?
Hi, I'm excited to be here. And Onyx Pharmaceuticals we are a biotech company located in South San Francisco, and we are about 1,000 employees. And my vision is really very similar, is we want to be very strong strategic talent partners with our business and really be able to support our global growth and really support the new products coming out. We have a team of 5 recruiters, and we have 3 researcher sourcers who support this team. And the focus is really to be looking at not filling recs, but finding talent. So we focus on quite a bit of passive recruiting. We do a lot of behind-the-scenes Boolean searches. We do a lot of research. And we look at a lot of other avenues where we can find these top-notch people that we're looking for.
Great. Thank you. And Matthew, how about you?
We currently manage 20 nursing homes throughout the state of Florida and Ohio. My recruitment team consists of about 4.5 FTEs, including myself. I have 1.5 people that dedicate themselves to our home health divisions, and then I have 2 under me that one predominantly focuses on managing our applicant tracking system, and then one that predominantly focuses on our college affiliations and recruitment program for schools. We do things that focus on technology and ease of use. Whatever is the easiest way to bring people to the organization is what we are trying to use.
Great. Thank you. Thank you for sharing. So to tag on to that, what we would love to discuss is your executive leadership and how that is involved in the recruiting strategy for the company. Do you have executive sponsorship for your recruiting efforts, or how involved is your executive team? Any thoughts on that for our panel?
This is Matt. Who wants to go first? Okay. Our organization, recruitment, is top of mind. It's one of the most significant pillars of the organization. We are a long-term care and skilled nursing organization predominantly, so there's a lot of burnout and turnover throughout the facilities we manage. So our focus is recruiting quality. We are struggling, and our struggle is to find excellent nurses and therapists that have a passion for geriatric care. So that's our struggle and our challenge, and that is what is top of mind all the way up to the CEO of our organization. So yes, it is a top of mind with our executives here.
And this is Teresa. I'd like to talk a little bit about, we have fantastic support from our executive team. We're viewed as a true partner. In fact, one of our corporate goals last year was staffing. And we are very critical and viewed as a very strong partner and able to meet our business needs. For example, last year we had FDA approval for one of our new drugs, and our staffing team was able to staff the entire sales force immediately. So, strong recognition through the board, strong recognition, through the earnings. We really are viewed as, we're very critical to the business, and we're viewed as a team that is really able to meet the needs of the business. Our executive team, we present quite often to our CEO and his direct reports. He's very actively involved and very actively involved in recognizing the team's achievements as well.
This is Irv Nahr. When we, 2 years ago, we had disparate recruiting organizations across each of the 5 hospitals, and we centralized the function. Of course, as a result of that, each one of the hospitals has its own CEO who manages each individual hospital as well as the physician organization. And of course, there was great consternation that centralization would not work and that they would not have direct control over the talent acquisition function. that consternation has been put aside, and as a result, they get talent acquisition involved right up front in all their planning, all the major initiatives that are going on, and any issues that happen to arise. So we are very much at the forefront, have become very much a strategic entity to each one of the CEOs, and are involved in all the senior leadership meetings on a regular basis.
Wonderful. Thank you, everyone, for sharing. I know that can be one of the greatest challenges for a recruiting organization is executive sponsorship and being highly engaged in the day-to-day process and really being a champion behind that. So thank you all for sharing that. Let's dive in a little bit into recruiting tools. So what do you all look for in tools to help your team with recruiting efforts? And are there any particular features that are more important to you than others, or some that work better for your needs?
I'll go ahead and start. This is Matt. Like I said earlier, our tools need to be very technology friendly. They have to interface with mobile devices because that's where everyone is at this day and age. And it has to be easy to use. It's really all about the candidate experience and the candidate being able to apply to the jobs very easily, and also being able to push jobs out and communicate to them all via social media. And we've been able to do that really well via many tools, as well as some of Jobvite's features that they have as well. Courtney, who couldn't be on the call today due to a situation, is really my Jobvite expert, but she uses the tool fabulously and has great success with it. But definitely technology and ease to use is what's most important to me right now.
And this is Teresa. I can add to that. I agree completely. The ease of use is going to be the most important because it's about, from the candidate experience, being able to access our jobs through mobile devices. I'm also looking from the recruiter and the manager side, a really solid UI and flexibility, something that the recruiters are going to go into and use. I think what's also very important is we do a tremendous amount of our recruiting through passive searches, and we are all of our recruiters and sourcers are Boolean experts, and we do really write the strong Boolean strings. So, for instance, like Jobvite Engage, it needs it's something that you can do the open web searches are, and something that you can do really good Boolean with as well.
This is Irv Nar. I would echo everything that everyone said, and I would add that we have developed a very strong proactive relationship recruiting model here, and it really would not work without a robust and effective CRM tool. So that's a key part of what we need and what we use, which is what attracted us very much so to the Jobvite platform, and that it is one of the few robust ATS systems with a very easy user interface that also has a very effective integrated CRM tool.
Great, thank you. And Irv, you had also mentioned your application process. Could you tell us a little bit about how you've been able to streamline that?
Yes. If those of you who may not be familiar with hospital systems, and coming from the high-tech sector as I did, I found it very frustrating that they try to knock out candidates on the front end. So the application process oftentimes would take a candidate 30, 40, or almost an hour, 30, 40 minutes or almost an hour to complete prior to being able to get into the system, providing licensure information, answering knockout questions, etc. We basically have reduced the application process to less than a minute. We operate under the philosophy that the more applicants we get or the more people that come into the system, that's more points of possible networking that exists. So we manage it from that end. So we have encouraged quick application as opposed to knocking out people on the front end. And as an example, 2 years ago, on average, we would probably, across the entire health system, we would probably get somewhere in the neighborhood of 800 applications. And now, through effective use of the tool as well as some branding activities that we have done, we average somewhere in the neighborhood of 8,000 to 9,000 applications a month.
That's incredible. Thank you for sharing, Irv. I know that this, is another one of the top challenges in recruiting is how you funnel people through the process and just getting them in the door, especially when you're in a highly competitive industry, healthcare, health and sciences. You really don't want to lose those top candidates from the get-go, and that is certainly a best practice that I've talked about with customers for years in my career, is really trying to hone in on that application process and at least get people in the door with the minimum amount of information that you need up front. So that's great. Thank you for sharing.
Can I add something? This is Matt. I would also like to add, in search for applicant tracking systems, I was searching for something that was ingrained in SEO optimization and also with social media. And just a little statistic, my website doubled its unique visitors the month after we went with the Jobvite applicant tracking system. So you're not only looking for an ATS, you want to look for something that has a far reach that will drive traffic to your website as well.
Wow. Thank you for sharing that. That's great. Of course, at Jobvite, we love to hear that. So thank you for sharing. That's incredible. Okay. Let's talk a little bit about some other, challenges that you face, being part of the larger health and sciences industry in each of your own segments. What would you say is your top recruiting challenge?
This is Teresa, and I would say being in the life sciences is more of a challenge. I come from the tech sector, and one of the things that I see is a lot of the individuals that we're searching for, we search a lot for board-certified oncologist MDs. We look a lot for scientists, PhD, drug safety and regulatory type of individuals. And they're the people who are not going to be out there. So they're not like tech where they're writing about blogs, or they're not going to be on job boards. And if they have a LinkedIn profile, it's going to be very basic and not tell anything about themselves. So we have to really focus on the very passive recruiting and really building a pipeline. And that's why the Jobvite technology is very key, because it allows us to write Boolean strings and do open web searches. We don't necessarily have to use Boolean. We can do open web searches. We can use the collections feature. But the real key for us and the real challenge is being able to build that pipeline so we can be proactive throughout.
This is Irv Nahr. I would echo what Teresa had to say. I think no matter what industry you are in, the biggest recruiting challenge is finding the best, irrespective of industry. I think we all share that. Healthcare clearly, at least in the hospital sector, has tremendous cost pressures. So we too have to build extensive talent pools that we could tap into on short notice, because we don't have the luxury of hiring people in advance. There's a lot of real-time, just-in-time kind of hiring that has to go on because of cost pressures. So building those talent pools through proactive recruitment is extremely critical to us.
Yeah, as Irv mentioned, we are in the process at Greystone of really developing talent communities and in groups of RNs or certified nursing assistants or LPNs and therapists within like Jobvite's community forums and portals that they have available, and being able to stay engaged with them and keep them informed with our positions that we have open all the time. We do have to be proactive, and especially in long-term care, there's extreme burnout, and there's many clinicians that are in long-term care that don't necessarily have a passion for it. And we are trying to gauge who truly has a passion for long-term care in our business by the type of engagement we receive back from our candidates.
Great, thank you. Thank you so much all for sharing that. Let's dive in a little bit into some details that are more specific to, let's say, pharmaceutical versus healthcare. So, Teresa, drug approvals can expand or contract hiring needs. So how do you adjust quickly to the changing recruiting needs of your organization based on that?
And that can absolutely be, it's a challenge. In fact, I've referenced, we had the FDA drug approval for one of our drugs last year. And, once it's approved, you have to be able to sell that drug, but you also have to be able to react if, for instance, it's not approved. So in our instance, we basically we hired 100 salespeople, and we had 100 offers ready to go the next day after we had our approval. And it's really key that you build a pipeline, and it's not only strong from a sourcing perspective, but you really have to keep these candidates warm. And you can have to keep them warm for up to a year. And that's why it's really important to be able to engage with the applicant, be able to send them notes, to send them correspondence, to be able to track them. And we did that all through Jobvite. And that really helped us keep these candidates warm. You have to sell the value proposition. And from there, then you have to be able to react as quickly as possible. So it definitely does have challenges from that end.
Thank you, Teresa. I know that's great. It really does come back to the relationship and having to keep those relationships warm and keeping people engaged for up to a year. That is just, that's a big challenge, and that's pretty tough and requires, you really have to be proactive and constantly engaged. That's great. So in terms of, let's talk a little bit more about, healthcare, healthcare hiring needs. So right now, they're predicted to continue to grow exponentially. So Irv and Matthew, how do you manage the volume of job openings compared to the volume of applicants that you get for those openings? Where are you particularly challenged?
Well, this is Irv Nahr again. I think when you talk about volume, I think when you shift from a requisition-driven recruitment strategy to a talent-driven strategy, a lot of the volume issues go away. So, for example, and I'm sure Matthew experiences the same thing, in a hospital setting, you will always need nurses. So if your strategy is to constantly recruit nurses as opposed to fixating on a requisition for a specific kind of nurse, then if that continuous recruitment produces a strong enough talent pool, you will be able to slip individuals into requisitions as you need them on a regular basis. So the key to addressing the volume issue is to stay away from the rec side of the equation and focus more on the talent side of the equation. We just have pockets of kinds of people that we know we are always going to need and that we are always looking for. And with that focus, a lot of the volume goes away, and we're prepared to do things on a rather quick basis.
And Irv, are you using any staffing agencies to help augment?
Unfortunately, we don't have any budget to use staffing agencies. And to be quite candid, I would rather not, because I want to build up the capability of my team, and showing results is the way to do that. So we have not been able to use the resources of agencies, and we are, in fact, an in-house agency and have been able to meet the needs on a regular basis.
That's great.
This is Matt. Very similar to what Irv said, but more about the moving candidates through the process piece. So we have just RNs and line staff level people that apply all the time. And what we do is Courtney, who is our applicant tracking system administrator, for lack of a better term, is monitoring candidate flow throughout the organization. And if she sees that people aren't being dispositioned, interviewed, screened, talked to, she'll call up that facility and say, you know, we see you have these RN positions available. You have these 10 RNs for various positions. They've applied to various positions, not even necessarily at that building. Maybe one of our sister facilities 10 miles away, someone has applied to that position. And she sees all this, and she is moving candidates from one building to another building into their talent pool, and then she's holding those buildings accountable for interviewing those people and moving them through the candidate process. And that is enabling us to find a better, more talented group of candidates for our positions instead of just sticking to the RNs that apply only to those specific positions.
I think the important thing here, this is Irvin, I just want to add, we keep talking about what we do, but one of the most important things, and I think it came up once before, but I think it requires emphasis, is the candidate experience. You can be the greatest candidate and the greatest recruiter in the world, but if the candidate experience is poor, you're not going to have very much success, and that word is going to get out. So a robust system, and I mentioned the CRM tool before, that allows you to maintain a very high level of candidate experience is absolutely critical. You don't necessarily want to recruit people because you have an opening today, but you want to build those relationships because you plan on having an opening tomorrow. And the only way they will talk to you and stay in touch with you is if you make that experience as pleasant as possible for them and highly professional.
Great, thank you. We do have a question from the audience that I would like to ask our panelists. It's about a diverse recruitment strategy. Let's see, diverse recruitment strategy for the major demographic shifts in our marketplace. Do you guys have any thoughts on that or anything you'd like to share? Go ahead, Irv.
Okay. I'm not sure what the direction there is, but we have a lot of community involvement here. So we do track our diversity within the health system, and diversity is extremely important to us because our health system employees have to look very much like our customers, and that's extremely important. So we do a lot of community outreach activities, both from the standpoint of recruitment as well as the standpoint of a hospital system and a healthcare system in the area that promotes support for the community. Our vision here at West Penn Allegheny Health System, as the second largest health system in the area, is to promote the health and well-being of the citizens of Western Pennsylvania.
This is Matt. We have done diversity recruitment events. We have very diverse demographics, especially in our South Florida region, and we do hold recruitment meet and greets to invite people from the community to the building so they could see it. Because, like Irv said, we need our customers want to be treated by people that are like them. So we really need to make sure we have the right people treating the customers. So we do have a very strict focus on diversity recruitment and making sure we are getting the right people into our buildings to work for us. Also, another thing that we do that has been highly effective, we offer free CEU events to the community. And what happens is we'll send out 5,000 mailers to RNs in St. Petersburg, inviting them to one of our nursing homes that might have several RN positions open. And then we will offer, we have a Vice President of Clinical Services here that's CE certified by CE Broker, and she'll give a presentation on whatever is important or required that year. Medical records, there was a medical records CEU that was required last year, and so we went to each region and offered a free CEU event to RNs in the community. And during this, we would offer free food, free drinks. We would have these after work, so on their after their shift, they would stop by our building, get some free ECEUs, some dinner, and then we'd give them our message and our recruitment message about the organization. So that's something that we do in our localized communities as well.
This is Teresa. I echo you. We're certainly very involved in our community, and we also focus quite a bit on, just overall diversity of thought. I mean, it's interesting. The demographics of Onyx is we probably have one of the most diverse organizations around, and that includes our executive team is extremely diverse. So I think with the focus on looking for diversity of thought, looking at hiring, the people suited for the job, I think to some degree it naturally forms as well, but you also have to do that outreach. And I think it does help when you have such a diverse group. It really commands that diversity from there.
Wonderful. Thank you all for sharing. I'd like to spend a little bit of time now talking about your employees and how everyone gets their employees involved in their recruitment process and really trying to inspire them to refer candidates and keep them engaged in the process. How does everyone manage their employee referral programs, or do you have a referral program?
This is Teresa, and we have a lot of fun with our employee referral program. We do have a formalized program where we offer every individual a dollar amount for their hires, but we really try to promote it by doing some fun events. We have what we refer to once a quarter as a sourcing jam, and that's bringing the company together. It's open invitation. Everyone brings their laptops, and we give them a tutorial on Jobvite and how to reach out to their network for referrals. And we make it fun. So we make it a team event. So the team that generates the most leads, we have a trophy that we engrave their team name on. We pass around each quarter. We'll give really just minor gifts, gift cards to a local retailer or a local coffee house. We'll give just $5 or $10 for the top 1, 2, and 3. But the most important thing is we bring everybody together. The idea is it's a jam session, so it's kind of free thinking, and it spurs a lot of ideas, and it generates on average anywhere between 800 to 900 leads.
I love that, a sourcing jam. Sorry, go ahead.
Unfortunately, due to budgets, we have not been able to offer financial incentives, but I have to say that it has not been an impediment to our employee referrals. When I got here, I think, and that was about 2.5 years ago, the employee referral rate was probably negligible in the 1 or 2% range. We have been fortunate enough to raise that to presently somewhere in the neighborhood of 30%, and we're shooting for 50%. And I will have to give credit to the Jobvite platform for allowing us to do that. The fact that we have had the ability to tie into every employee's social network and allow employees to broadcast our positions on an easy and regular basis has just been tremendous in terms of providing us with employee referrals. So that has worked out extremely well for us. We promote it, and people here are very free to do that, in that very much so, just like any environment, but in the healthcare environment, people want to work with people that they like or that they know, so they're very encouraged to bring in their friends.
This is Matt. We do have an employee referral bonus, and that bonus is actually a dollar amount that's broken out quarterly. So they're paid a quarter of it after each successful 90 days of their referral. And what this does is it gives the employee that referred their friend or candidate incentive to keep that referral engaged and motivated and excited about working for the organization for over the length of the year, because sometimes there's just employee referrals, and previously we had employee referrals that they would refer an employee and they'd be gone in 2 months for one reason or another. But now there is a monetary incentive and referral bonus for not only the referral, but in order to receive the full amount, they have to keep that employee engaged throughout the tenure of the year.
If I could add just one thing, and I think sometimes it's overlooked when we talk about referral programs, and it's really to encourage your recruiters to ask. So when you hire someone, if you ask the person you hired, who at that point in time is very engaged with you, who are the best people that you worked with, it's amazing the kind of information you get. And if you have a proactive recruitment program, it's just tremendous in building up those talent pools.
Great. Thank you so much for sharing. And of course, at Jobvite, that's a large piece of what we talk about is, building that pipeline through referrals and also being able to track the success of your referral program. And just find that the quality of hire, studies have shown quality of hire tends to be greater with hires that are made through employee referrals. They tend to have a longer retention as well. So it's absolutely a fabulous idea to really have a robust program around that. And Irv, it's great that it's working even without major rewards that other companies might be offering. That just really says a lot about the passion behind your brand. So let's talk a little bit here about emerging technical requirements, so certifications or technical requirements for the types of employees that you're looking to hire. How do you really stay on top of that and track any rising stars maybe within your own organizations?
This is Irv again. As Matt will probably echo, we are in a highly regulated industry. Where certifications, licensure, all those kinds of things are extremely important, or you can't work here. So we have to stay on top of that on a regular basis. We clearly have tracking systems that are in place because a lot of these certifications and licensures expire. So we stay on top of it. But there's also changing regulations within the industry, and I have to credit the Internet with allowing people to get educated really quick. And it's really the recruiter's responsibility as a group to stay on top of those issues and be at the forefront.
This is Matt. Absolutely. Also, to let you know a little bit how we engage our people is we have several programs. We have a nursing excellence program which allows for after nurses are employed with us for 1 year, they are allowed to register to be entered in our Nursing Excellence program. And if they're accepted into our Nursing Excellence program, throughout this program, they are trained on a higher level skill set than some RNs. Maybe there's an emphasis on cardiac care or orthopedic care or IVs, that there's certain specialties that they're being trained on. And after they reach each status or level, whether it be bronze, gold, or platinum, there's a monetary award or bonus attached to that. We also have a similar program with the therapy here, and it's called the Rising Stars program. And each of their tiers is equated to a star, like a nova or a supernova, as they go through the program. And every time they reach a new level of expertise, they will also get a monetary bonus. We are about to roll out our electronic health record system in the next few months, and one of the items Courtney's been tasked with is to do skills assessment. So she is putting just a computer basics 101 skills assessment together, and she is going to the buildings to assess pretty much all the employees at each building to make sure they're ready for EHR. So those are some of the things that we're doing at our organization to assist and track technical and skill level requirements.
And this is Teresa. One of the things that we're doing, we also have to hire a very specific skill set that have specific degrees and specific certifications. And one of the things that we are doing is obviously we do the normal research. We have one individual who's devoted to doing competitive analysis, so he's focused strictly on any of the new FDA approvals that come out, what's going on in companies around us. I mean, we basically very much our own internal competitive intelligence group. The other thing that we do is we are really using the social media, so we really tap into, for instance, Twitter. There are certain things like the American Society of Oncology that puts on a big conference, so we follow all the people who follow that, and we look at their followers. So we dig really deep into Twitter. There's a couple of other oncology conferences or people who follow certain cancer organizations. So Twitter's been a big source for us. The other thing we do is we really dive into what's coming out from a patent perspective. So we do searches on a daily basis of patents, who's been granted a patent that might have a certain molecule that's applicable to us. We also take a look at, again, we have that same individual of white papers that come out. So we take a look at every white paper in our industry, who's writing the articles, who's involved from an academic perspective. So very much just having that research focus and one individual dedicated to that.
Great. Thank you, everyone. And on that note, tagging on to that, how about education and technical training that's required for people that you're looking to hire? How do you really ensure that you're getting better trained applicants?
We have, we have relationships with educational institutions clearly to increase the educational level of a lot of our different specialties. So, for example, nurses, there are associate's degrees, there are diploma nurses, there are bachelor nurses. So we have programs established in relationship with a lot of the educational institutions in the area to upgrade our nurses to bachelor's and master's after hours, online, et cetera, et cetera. And we pursue that quite a bit. A lot of the other specialties likewise. So it's those relationships with the educational institutions that I think we use to effectively increase the skill levels of the people that we have. Plus, we provide a lot of input to those institutions in terms of the courses they are offering and how they're structuring their programs to better align those with the needs of the hospital system.
Yeah, like Irv said, we also have partnerships with schools in the areas where we try to get our employees and encourage our employees to go back to school. We offer a pretty aggressive tuition reimbursement program for most of our employees. Also, like I said, I have a person that's pretty much dedicated to college recruitment, and they are in charge of building student affiliations and managing our clinical rotation. So we have students in all of our buildings at any given time. Right now, we probably have a total of, my last report I checked was 55 nurse students rounding in our buildings for their clinical rotations. So, you know, partnering with these schools allows us, one, to mentor these students in our buildings, to assess their clinical skill sets to make sure they're appropriate for what our needs are, and 3, if they are, recruit them directly from the school into our building. Since we know them, we've seen them interact with other coworkers and patients during their clinical rotation.
And this is Teresa. One of the things, you know, where we're at from in the pharmaceutical space, we do require most people who have experience, but we are developing quite heavily our college intern program, and we're looking primarily in our research and clinical groups for those positions, and we're also developing the internships and our G&A functions.
This is Irv Nahr. One more thing I would add is we developed what we call an ambassador program here. So we actually go out to schools, and we have a selection process where we will pick one or more students to be ambassadors for the health system. So basically they promote our health system within their classes. So it could be a nursing school, it could be a school for physician assistants, for nurse practitioners, etc. So that they actually become ambassadors for us. We give them certain perks within the health system, like access to professionals, internships, etc. So that's how we get the word out and get ourselves in front of some of the best students at the different institutions.
Wonderful, thank you. So you all have shared a lot about, you know, systems and processes and some great programs that you've set up for recruiting. But if you had to provide a single best practice for recruiting to someone setting up a new recruiting effort in your industry, what would you say?
This is Matt. My opinion is that every employee needs to be a recruiter, and an organization starting needs to get a buy-in from the employee on the company culture and mission, so they are that effective recruitment voice. An employee is an extension of the recruitment team and the organization, and they are the best voice based on their experiences, and also a palatable referral bonus to go hand in hand with that to incentivize them even more.
This is Irv Nahr. I would say the best practice is the recruiter. Too many organizations take someone out of the human resource department and make them a recruiter. If you're going to do recruiting at its best, recruiting is not a human resource function, it is a sales function. Hire the best possible recruiters that you can get. They are the key to your success.
This is Teresa. I echo that. It's the recruiter. You have to hire the best. But the other thing is, I think what's very important, what I look for, is someone who has that intellectual curiosity, somebody who's going to really want to get there and understand the job, ask the right questions, get in, how does this affect the business, you know, how would this relate to cross-functional teams, but somebody who has that, just that natural curiosity.
Those are all great. Thank you. Irv, would you like to share a little bit about how you treat your internal transfers different than your external recruiting efforts?
Sure. when I first got here, it was apparent that the recruiting staff was spending a significant amount of their time doing internal transfers. And of course, internal transfers are extremely important. I'm not trying to minimize them. The problem is that if you have a proactive recruitment function, the skill level of a proactive recruiter, which is, here again, a sales business, as opposed to transfer activity, which is a transactional activity, are totally different. So one of the immediate things that we did was separate transfers from proactive recruitment. So we actually have one or more transfer recruiters that do absolutely nothing but transfers within the health system. And in addition to that, we've expanded it such that they are also career coaches. So a lot of people apply for a transfer simply because they're tired of what they're doing and they think that job that they applied for is a lot better, but they really know nothing about it. So we have engaged these transfer recruiters not only to affect the transaction, but to be career coaches and counsel the people that have applied for transfers. And a lot of them drop out at that point in time because their perception was totally wrong. That has saved tremendous amount of time for the proactive recruiters to do what is extremely important for them to accomplish, which is get the best talent and build those talent pools.
That's wonderful. Thank you. So let's talk a little bit about, the passive candidate. I know, Teresa, especially, this is something that's really a big challenge for you, and talking about how do you really go after that more passive candidate and attract them to your organization.
It is. This is Teresa, and that's the most challenging part of the role, but it's also the most important part of the role. And it's not only being able to track the passive candidate, but what's a candidate now may not necessarily be a candidate tomorrow, or someone who's not a candidate today could very well be a candidate tomorrow. So it's really keeping those candidates organized. It's being able to continue keeping in contact, keeping in communication with these candidates, tracking their career moves, tracking, what they're doing, if they're going in front of the FDA, if they've had approval. So it's really being able to keep organized, being able to run really strong, reports, and being able to keep in constant contact with these people.
Thank you, Teresa. Irv or Matt, did you have anything you'd like to add to that?
I don't.
No, I echo everything that Teresa says. I think she's right on top of proactive recruitment, and that's where you have to be to get the best.
I would like to mention something that Irv said. I do agree 110% that the recruiter needs to be able to sell and be a salesperson, and I am a case in point of that scenario. I had no HR experience, nor did I have recruitment experience before I took this position. I was hired to the organization because of my sales experience with Career Builder and my sales training from ADP. And then I brought that sales-minded aspect to the recruitment business and learned recruitment. And so I agree 100% that each of your recruiters that you hire, you take a chance on hiring someone outside of the recruitment industry that has extensive sales experience. You might find it to be very successful, but having an outgoing personality, build relationships to the candidates over time, and ability to sell the organization is the most important pieces of a successful recruiter. So I agree with Irv 100%.
Yeah, absolutely. I think everyone would agree with that, and that's something that's not always a focus, or they're not always empowered to take on that role. So I think that's a really great way to look at it. Let's talk a little bit about metrics. How do you all measure success? What type of metrics are you looking at on a regular basis?
This is Teresa. I look at different metrics. One of the ones I find most important is I look at, are we filling the job by the date need by. I don't track how long a rec has been open, because there are some of those jobs that maybe be the evergreen jobs or the jobs that require a year to recruit for. So I think it's really important that we are meeting the needs of the business and filling the jobs when the business needs them by, which is why I look so closely at the date need by, because some jobs will take a year to fill.
This is Irv Nahr. I think from our end, first of all, quality of hire is extremely important, and we've created a feedback loop from our performance management system to track everyone for at least a year. But one of the things that we also do, and is I find top of the list, are candidate and manager satisfaction surveys. Everybody that gets hired gets a survey to fill out on their experience, and every manager that hires someone likewise gets a survey to fill out. And we track those on a regular basis and have metrics that we try to meet in terms of satisfaction levels. And we have exceeded them every single time, and we will continue to do that.
This is Matt. Unfortunately, we don't have any grained metrics yet. Quality of hire is something that I definitely am trying to put together this year, ending FY 2013. However, right now, basically, it's reducing recruitment spend, agency spend year over year, which I've been able to do every single year. But that's how we've been measured up until this point. But I'm trying to put together some more firm metrics going forward the remainder of the year, and so forth and so on.
Wonderful. Thank you so much. I know we've just got a couple minutes left here for our discussion, so I would like to wrap up with one final question for the panel. And if you could share how you plan to actively improve your recruiting efforts for the remainder of the year, or what do you see coming ahead?
This is Matt. My focus for the remainder of the year is to get all of our employees engaged and to be a voice for and of the recruitment team. We have marketers in every region that are salespeople. They're in hospitals selling our services to patients, doctors, and residents. There's no reason they can't mention a position being open in our organization to people they meet daily. So my goal for the remainder of the year is to make our employees a better voice of the organization.
This is Irv Nahr. I think one of our principal focuses is going to be mobile, and we are going to go strongly in that direction. Continued recruiter training such that people are always honing their skills and at the top of their game is another emphasis that we have. And employee engagement in terms of, it's my goal to make all 11,000 plus employees at the West Penn Allegheny Health System a recruiter.
And this is Teresa. The real focus is going to be continuing to develop our presence in social media and to really take advantage of some of the tools. We are in the process of revamping our career website and really going out with a strong social media practice and policy, and then to continue being talent partners with our senior leaders.
Wonderful. Well, we are at the end of our hour here, so I would like to thank all of our panelists today. I think we had a really great discussion, a lot of great ideas to share with our audience, so thank you very much. And thank you, everyone who dialed in today as our audience. I hope you found this to be a valuable session, and we appreciate your time.
Thank you so much, Shannon. Just a quick reminder that by the end of the day tomorrow, you will see an email that will include today's roundtable recording and information containing HRCI credits. This information will also be available at ERE.net. A big thank you to Shannon, Teresa, and Matthew for sharing with our audience today. And another huge thank you for Jobvite for sponsoring today's Roundtable webinar. I hope everyone has a great day.
Ladies and gentlemen, that does conclude the webinar for today. We thank you for your participation and ask that you please disconnect your lines.